So what is really possible? Okay, the research has told us that it's about lifestyle choices, but what is really possible? So we set out right from the beginning, we knew we had to measure. And so well, first of all, let's level the playing field. What is possible? I've heard many times people in higher levels of care and people with impairments, look, let's not make any unrealistic expectations, okay? So I lead with Stephen Hawking there. Okay, he's a young man, but still, at 29, he gets a diagnosis of Lou Gehrig's disease. You'll be dead in a year, and in a year he's paralyzed except for his lips. That was 45 years ago. Still alive, and has made more contributions to our understanding of the universe probably since Galileo. So let's start there. So let's not hear about impairments and unreasonable expectations that we give people. We're complex people. We're complex beings. We're physical beings, social beings, spiritual beings, and intellectual beings. We can always grow, always grow. When we stop, well, we die. So we're looking at aggregate data here. We developed some tools from the MacArthur study tools, from the Mayo Clinic, and some others that we put together, and we use that to help a resident take an older adult, look at their lifestyle, get feedback, and then with some help make some course corrections. Over on the right are the things we ask about in the physical component, in the physical dimension. This is aggregate data. It's from our original pilot. The ends are a lot larger now, but you see that the baseline age at 1 was 83 and a half. So over at 4, they're 87 and a half. So here you have physical growth in those parameters. Social connectivity, same thing, same age group, growth. Intellectual, growth, then a leveling off intellectually. Spiritual, defined over here in a broad sense about, meaning and purpose, really, if you want to put it in quick. And the Tonetti score, you know that. That's about gait and balance. Growth, starting at 83 and a half. Now, these were all independent living. So let's go on. Assisted living, geriatric depression scale. This was a test. This is a pilot we did in 16 weeks. Small number, but again, we were just setting out into higher levels of care, and we wanted to demonstrate it. Geriatric depression scale going in the right direction. The other physical steps going in the right direction. If it's lower, it's a time thing, or if it's a strength thing, it goes the other way. They're all going in the right direction. Physical, all these 4 except for the lower right, that's Folstein's mini mental, which going in the right direction. And this is for memory care. Memory care fall risk, going in the right direction. Skilled nursing, physical parameters, and all going in the right direction over 16 weeks. So people are able to grow, and it's not just our research. It's validated. We're complex beings. So how can we be satisfied with the status quo? How can we be satisfied with stability? It's a good goal. In fact, sometimes our data shows stability, and we wring our hands and go, stability. And Dr. Kahn, who headed up the MacArthur study, works with us. He's our leader. Says, whoa, wait. In the 9th decade of life, stability? Whoa, what an accomplishment. Don't start wringing your hands. But we usually see improvement. It's not enough to have comfort and security. That's what our industry has been providing since we began. Comfort and security. It's wonderful. We have to continue to do it. It's important. As humans, we need to do it. It's altruistic. It's what's required. But it's not enough to see the growth. It's like the brain. We know that we can maintain our brains if we keep them busy, but if we learn new things, we now know we can grow new brain tissue, reducing the likelihood of early onset dementia.